Hi, this is Megan from the Animal University. I'm here to help people empower themselves that can help heal their animals. Um, I'd like to talk about spay and neuter. I know that's a common thing with the rescue groups when you adopt and you rescue animals and cats and dogs, and the vets will be proponents of that. But it's a sparing technique surgery where ovary sparing technique surgery and then a testicle sparing technique surgery. So instead of the full spay or neuter, they actually retain the ovaries in the females and the testicles in the males. So if you just start researching on your own, like say the role of testosterone or the role of the estrogen or the role of the ovaries, the role of the testicles, and what the hormones that each produce, how that benefits the body, whether it's human or animal. So this can apply to humans as well. Um, I know several females who've had hysterectomies and then have had a slew of issues, either shortly after or long-term effects of basically putting the body into a forced menopause. And in a sense, that's exactly what's going on with the animals. And this isn't about a reproductive uh, issue, because if you do these sparing techniques, the animal still can't reproduce. They may exhibit still the behaviors, like a female still may go into heat where you may not see like a menstruation, a blood flow, but she may exhibit other behaviors of being in heat. Males may be a little more prone to seeking out females and other behaviors. So you just do the research and you look it up on your own and see if it fits what you're looking for. A lot of owners don't want to be bothered with having a female going into heat, even though she can't get pregnant, but they just don't want to be bothered with the symptoms that may come along. And the same with if you have a male who tends to roam or may roam, or may do like a humping behavior, or may try to make it a little aggressive. I personally know a lot with my clients. I have a lot of animals that aren't spayed or neutered, and there's males that there's no issues. I mean, other than still seeing the testicles on them, there's no humping, there's no any of the aggression with other dogs, even other male dogs. There's no escaping or running away. So you really have to see the behavior of the dog. Definitely consult with your veterinarian, your vet health professional, and see what they would suggest based on your individual needs, your animal's personality, and if you can come up with a strategy, whether it is the full spay or neuter. There, though, you have to do the research on your own too and see the effects of taking those hormones out of the body. And especially if you adopt or rescue a dog these days, they go for a while now. They've been going back as early as 2-3 months old that they do these surgeries, these procedures. And if you look into that and translate that into a human, it sounds preposterous and effects you would think would be devastating, even though you may not know scientifically or biologically what it would do to your system, but it just doesn't sound right. And I know we've been, of course, keeping the population down of animals. These spay and neuter programs have been in place for so long. We still have the overpopulation. Unfortunately, a lot of animals are still being euthanized because there's not enough homes for them and they are reproducing. So a lot of it does come down to owner responsibility, people responsibility, the human responsibility. I don't think you can take that out of it. That's a big factor, that if you, and every situation is different, but if you can take the animal's health into consideration, the vets technically learn how to do these ovary and testicle sparing surgeries. They're basically a shorter version of the full spay and neuter. So it's less time under anesthesia, it's more quicker recovery time, and the animals get to retain the female gets to retain the ovaries, the male gets to retain the testicles. So they get those hormones that are very much needed, especially at 2-3 months old or 6-7 months old, which is usually the traditional time frame that the vets will recommend spay and neuter. And they're just infants, and their systems aren't fully developed yet. Any of their systems, immune, cardiovascular, their bone structure isn't completely formed. And when you take these hormones away, after you research and see that the roles that these hormones play, and their body is technically in this undeveloped state, and then you're taking these hormones away, and then their body is just struggling the rest of their life. If you do have that's been a passion of mine with my dogs, that they came already fixed when I adopted them. My research is finding that if you keep the diet as clean as possible, keep the stress level as low as possible, and try to support the body, the animal's body and their systems with, just good nutrition and low stress, exercise, meet their needs so they're happy mentally, emotionally, physically, spiritually, and, supplementation with a good quality vitamin, mineral, some either healthy oils, olive, coconut, fish oils, krill oils, whatever you can get near you, the best quality possible that you can afford, and just trying to keep them, healthy as long as possible, because a lot of the issues do come from those hormone issues. And I would encourage any vets or practitioners, human or animal, that are viewing this video to feel free to leave a comment or to reach out to me, because I'm always researching this and trying to find practitioners, veterinary and human alike, that support this type of research and can support the animals that are fully spayed and neutered, and the ones that are, partially spayed and neutered, and any potential pet parents that may be looking to adopt and rescue, that they're able to pursue this sparing technique with their vet, or seek out veterinarians that are doing it. But from what I've researched and have consulted with some veterinarians that do the sparing surgeries, they learn this in school. They just learn the full version, how to take out the testicles and the ovaries. But this would basically stop, short of removing those organs, which again results in a quicker surgery, less anesthesia time, and a quicker recovery. So it is something worth pursuing with your vet and talking to them and seeing if it relates to your particular, individual case, depending on your lifestyle and your animal's personality. And if you think that the sparing techniques would definitely be better for them. But all in all, the research shows that it is more beneficial for them to retain their organs. And the same applies to humans. You can do the human research and apply it just, with the animals that have those organs as well. And when you remove them, the effects it can have, we'll do more videos on this, but this was just a general to get it out there. And I'll have some links and things to resources that you can research as well, about this further. Okay, thanks for listening.